September is Infant Mortality Awareness Month, and there is promising news in Oklahoma. According to the Oklahoma Department of Health, our state's infant mortality rate has dropped by nearly 20% in the last 15 years. Taylor Jackson joins us to explain why and how that's happening. Taylor.
Yeah, Rich, a big part of it is just getting the word out there through an education program called Preparing for Lifetime. It's everyone's responsibility, which helps educate women on what to do before, during, and after pregnancy to ensure a healthy, happy newborn.
Since 2007, the Oklahoma State Department of Health has worked to reduce the number of deaths of Oklahoma infants.
We are very excited that the infant mortality rate has dropped from 8.2 to 6.6.
That's 6.6 deaths per 1,000 live births. Joyce Marshall is the Director of Maternal and Child Services for OSDH. She says this means about 75 more babies a year live to see their first birthday.
Just totally unacceptable that our babies were dying at a higher rate than many throughout the nation. And so partnerships came together, and individuals and families, and we all worked together on a campaign called Preparing for a Lifetime. It's everyone's responsibility.
The Infant Mortality Reduction Program focuses on several factors that contribute to infant death.
Those are in like preconception, prematurity, tobacco and smoking, maternal mood disorders.
The three main causes for infant deaths are birth defects, sudden infant death syndrome, and complications from premature births.
Complication rates can be higher in both extremes, both in very early pregnancies, meaning when moms are very young, as well as when moms are older.
Premature or preterm births happen when a baby is born before the 37th week of pregnancy has been completed.
When I went into the hospital, they told me that I had to have an emergency C-section. He came 9 weeks early. He was supposed to be born on April 12th, and he came on February 28th.
Premature infants often have trouble breathing on their own and keeping warm.
He spent 2 weeks in the NICU. He had breathing problems. He had 2 holes on his heart. They had put IVs in his head. It was just like a whole bunch of stuff. They had to do 2 blood transfusions.
First-time mother Jaden Clark says it was hard to watch her child go through so much at such an early age.
It was scary. I was 15 when I had him. You never want to, walk in and, see like IVs in your baby's head. I had to experience that.
And while some preterm babies have lifelong conditions or die, some grow up to be healthy and strong. Clark's son is now 3 years old and his heart condition has improved.
Now they're saying that he's perfectly healthy. They don't see any problems with him. The holes on his heart, they have closed up.
Marshall says people of color tend to have a higher rate of infant mortality.
We've been working to reduce that as part of the infant mortality reduction program because it should be equal across all. But there are still disparities. They've come down, but they do still exist.
Pediatrician Dr. Asif Safarullah says a healthy mother is extremely important in producing a healthy baby.
So when we talk about infant mortality, we quickly tend to jump to just the baby, but also remember that it is a bond, right? So it is the mom basically is carrying this baby all the way to term. And so the health of the mother is equally not, if not more important in preventing or reducing infant mortality.
Safarullah encourages those who become pregnant to seek health care for during and after the pregnancy.
And that goes to not just physical health, but also mental health, because postpartum identifying and seeking care for postpartum depression is a very important matter.
Be healthy before you even get pregnant. Plan your pregnancy. Work with your provider so you have like chronic health conditions under control. Stop any alcohol or drug use or smoking.
Smoking and drinking while pregnant causes complications such as premature deliveries, SIDS, and other birth defects. Dr. Safarullah says that it is recommended that if you do choose to smoke, do it while you are not pregnant and go outside of the home, away from the child.
We do talk about secondhand smoke, not just in the vehicle, but also in the house. So smoking in another room of the house is not okay. Definitely you have to go outside, and remember to wash your hands and change your clothes once you come back inside.
Marshall says eliminating stressors during pregnancy can help prevent complications as well.
And anyone can help her with, so they can help provide a less stressful environment. Another thing, stress can help cause prematurity. So if we can help our mothers to have less stress in their lives, relax, self-care.
The Oklahoma State Department of Health expects the infant mortality rate to continue dropping as Oklahomans become more educated on how to help reduce the risk of infant death.